Hello, and welcome to my virtual presentation here at the Society for Academic Emergency Medicine 2020 conference. My name is Nick Mazer. I'm a third-year medical student at Marian University in Indianapolis, and I worked on this project with those mentioned on the screen, who are all affiliated with Wayne State University School of Medicine in Detroit. A special thanks to Dr. Paxton for his guidance throughout this process. I don't have any disclosures. So to introduce our study, we saw that the Surviving Sepsis campaign gave guidelines and recommends fluid administration of 30 milliliters per kilogram of crystalloid fluid for those patients who are septic with a lactate of above 4 millimole per liter. And they recommend this be done within 3 hours of emergency department arrival. We found that there was little guidance provided for pre-shock patients, which we designated as having a lactate between 2 and 4 millimole per liter. We found that the relationship between aggressive fluid resuscitation and mortality in this pre-shock population is really not well understood. For our methods, we did a retrospective review of emergency department visits over a 5-year period. This was at 2 urban institutions between February 2010 and March 2015. All patients were diagnosed with sepsis, and all again had this initial pre-shock lactate level of between 2 and 4 millimole per liter. All decompensated enough at some point to require vasopressors, not in the first 3 hours of ED arrival, but between 3 and up to 48 hours from ED arrival. Patients receiving at least 2 liters of crystalloid fluid within the first 3 hours of arrival were compared to those receiving a lesser amount. Data was collected on patient demographics, vital signs, laboratory tests, medications, comorbidities, and outcomes of hospitalization, including mortality. For our results, we had a total of 150 patients. Our mean age was 64.7 with a standard deviation of 17. Our median weight was 71 kilograms. A significantly higher amount of males than females received at least 2 liters of that fluid within the first 3 hours. About 60% of males compared to about 34% of females. Overall, our in-hospital mortality was 29.3%. For those receiving at least 2 liters of crystalloid fluid within 3 hours, they had a significantly lower mortality rate than those who did not receive at least 2 liters within 3 hours. So we had a 21.3% of those who received 2 liters expired in hospital, while 37.3% of those who did not receive at least 2 liters expired in hospital. In conclusion, we saw that the delivery of at least 2 liters of crystalloid fluid within the first 3 hours following ED arrival significantly decreased mortality in pre-shock patients who ultimately required delayed vasopressors. We found that sex caused differences in fluid administration, and we think that this could be due to weight or comorbidities. Individual weight-based administration of fluids was not evaluated and will be evaluated in future studies. For this study, we feel is required, including larger data sets to determine how pre-shock patients should be managed. And this abstract is a part of a larger study where we're looking into larger data sets, lactate clearance, liver function tests, troponin, among many other variables, essentially to determine what tools or values can emergency physicians use to evaluate pre-shock patients and how aggressively to treat these pre-shock patients in that first crucial 3-hour window. Thank you again for coming to my virtual presentation, and thank you to the Society for Academic Emergency Medicine for making this all possible. Again, my name is Nick Mazer. If you have any questions, feel free to reach out to myself or Lauren. Thanks again.